Welcome to another episode of the Movement Revisionist Podcast, where I help you redefine human movement one episode at a time. That's kind of a long intro. It's still a work in progress. But I have a couple special guests. This is the first time I've had two guests at the same time.
Couple? Yeah.
Well, couple, yeah, there's a couple entendres right there.
Yeah.
I am here with former interns, Billy and Maddi. Well, why don't we just start with introducing yourself and kind of what you've been up to since you left the Reach fam.
Yeah, so we got to do our last few trimesters at Reach. We went to Logan University where Dr. Mitch went.
Go Leopards.
Great school.
Wait, Leaders Made?
Leaders Made.
Yeah.
Student
Hashtag.
first. Students first.
But it was a great experience. We got to learn a lot from them, chiropractic-wise and business-wise. So we had an idea of opening up on our own. We were kind of nervous to do it, but I think with the kind of learning from you guys, we had the confidence to be able to do it. So we, at the last trimester, we did a little bit less interning, a little more in
planning.
The closet, in the back.
Sorry, RJ.
Yeah, of planning our business, making the logo, stuff like that. So we opened up a few months after graduating.
Yeah, and now we're actually in the Lion's Den. We are, well, I don't want to intro it. What is the practice called? Where are you located? And then maybe like website. You can give your info.
Ooh, yeah.
I won't cut this part.
Yeah.
Yeah.
So our practice is called Core Chiropractic and Performance Center. Core CPC for short. Not a lot of people call it that though. I don't know. We'll see.
Do.
Yeah,
We
we
do.
call it that.
Yeah.
Some do.
Yeah.
It's in Livonia off of Stark and Schoolcraft if you're a Crossroads person. I'm not from here, so I'm getting used to that.
Oh yeah, I forgot about that.
Yeah. And our website is corecpc.com.
Same with our Instagram handle, and pretty much all of our social media is Core CPC, at
Yeah.
Core CPC.
Nice. Well, you introed yourself. Let's go to the other side of the table, I guess. Billy, tell us who you are. I know you're more of the local protege.
I wouldn't go there. But yeah, I am from Livonia here. Grew up 6 in Merriman. Went to Stevenson High School. Went on to Western Michigan where I got my exercise science degree. And then from there, I knew I wanted to be a chiropractor. Sorry about that if you can hear the people on our roof. They are fixing it.
I was like, do you have enough stairs
Yeah,
here?
no, someone's on the roof fixing it.
We might cut that. I think it
Yeah.
adds character.
Yeah,
though.
exactly. But yeah, at the end of undergrad, I was trying to figure out where I wanted to go to chiro school. Looked around a bunch, and Chicago was the closest. Didn't really vibe with it. I have family in St. Louis, so that's where I kind of ended up, thankfully, because that's where Maddi and I met. And went through school together. Again, like she said, we had really good mentors and kind of gained the confidence in school. Got our hands and our feet wet really, really early on. And again, that's what gave us the confidence to kind of build this.
Yeah, which I admire. I took the easy way out. I looked for a place to work just because I don't know if this is a shocker to anyone if they're still in chiro school. You don't learn a lot about business and how to run a business. You have business courses, leaders made, not business leaders
Not
made.
business made, no.
Yeah,
Absolutely not.
yeah. Well, we'll see. Hopefully that curriculum will change sooner than later. But I admire it. You've been open for how long now?
We opened our doors February 20th, so about 8 months?
Yeah.
Nice.
Yeah, 8 months.
It's going by quick.
Yeah.
And
Yeah, dang, 8 months.
Any big lessons? Because I don't know if any students will hear this or other young chiropractors or PTs. What advice would you have for them if they're looking to open their own?
Yeah, good question.
I mean, it's probably not a easy answer.
It's a very, very, very loaded question, and I think it starts when they're actually in school. Try one, showed up and face pampered and everything, and I just took everything in as they gave it to me. Mm-hmm. That's all I knew what they were teaching me. And then trimester 2, I started branching out to local docs, and they became mentors and now friends. And how we kind of run this place, we kind of take bits and places from all the people that we got to shadow and be mentees to.
Well, I'm actually glad you brought that up, because anytime a student comes and shadows me, I think one of the big things that I wish I did, I shadowed a few times, but it was only a few times.
Yeah.
I wish I started that process early, and not just shadowing the same office every time. Really get out there, because then you can kind of see how businesses run.
Yeah.
And even if they're like a traditional chiropractic office, you can get a little flavor of business sense and how they run those operations.
Yeah, for sure. And going back to like my butt being in the chair at school, that's so different than actually being in the clinical side of things. Like, I would learn about things in school, but then I would go and sit in a corner and shadow a few docs a couple times a week, and I would see the things I'm learning about being applied, and how they see that, and how their brain kind of functions around that that issue.
As far as like the actual clinic setting and seeing that, and I think it's hard not to, as a student. I mean, I didn't plan on this being a kind of a student podcast, but I mean, we can go this route.
Yeah, absolutely.
But you're so focused on wanting to be a good clinician as soon as possible that that's why I admire you two, because I wasn't even thinking business at all. I never even considered it. And kind of having those thoughts while you're still a student, but also while your higher priority is, how do I just be one of the best in the world, right?
Yeah, exactly. And I feel like to be talked about as one of the best in the world, you have to surround yourself with the best in the world.
Absolutely.
So that's why we got close to the Brett Winchesters, the Taylor Premers, the now Pete. I don't even know Pete's last name. I think Roy or something.
Yeah, Pete Roy.
Yeah,
shout
out
Winchester Spine and Sport.
Absolutely. And then the Tony Katakis is the
Mecca in Troy, Missouri.
The Scott Grogan. Yeah, no kidding. But all these people, they're talked about so highly, and me being competitive, that's just my nature to kind of grasp onto those types of people. That way I can take things that they teach me, and now I can beat them.
Yeah, for sure.
That's like, how my brain works.
You need mentors, but like one of my things is, I didn't get into this profession to be second best. You know, you're always striving to get better and better. Unfortunately, we know some classmates that probably are just good with being middle of the pack, but I mean, I think that's what separates. That's why we go above and beyond with our care, and most people wouldn't even know we're chiropractors if they watched a visit of ours. Which maybe that would be a good transition of, well, we already know how each other practice is probably pretty similar, but what makes Core different than all the other chiros, especially in this Livonia area?
I'll start with a funny story from literally this morning. One of my patients over at Ethos, I train at a facility out in Plymouth, Ethos Human Performance. Shout out to them, they're amazing.
Shameless plugs.
Yeah, exactly.
Left and right.
Yeah, Monday, Wednesday, 7 to 1, come see me.
I won't bleep this.
Oh, yeah. But no, one of my patients there, he was explaining to me, he's like, yeah, I'm talking to my family and friends and saying like, yeah, my chiropractor is doing this and we're doing that with, like, I'm doing that with my chiropractor, but I don't even like calling you my chiropractor, because like you're so much more than that. Like people think chiropractor and they think just like adjusting bones back into place and stuff like that. And for him to say that, like, just made me smile, because like that's what we kind of preach in here, that hey, we're not just adjusting bones back into place. Maddi and I like to call ourselves more so movement specialists. We say, hey, we're chiropractors at the end of the day, but we really look at ourselves through like a movement lens, and that's kind of how we start and run this practice.
Yeah, and we just make sure that everyone feels heard when they're in here too, because there's so many patients that come in and say like, I've tried everything, like people just give me a hand wave, or like, oh, you're a mom and you pee your pants, like that's fine, like that's what every
that's
mom
normal
has.
right?
Yeah, totally.
But I think people know when they walk into our door that they're the only ones that we care about, and when they're in our room, we are sitting there listening to them, really care about them getting better. and doing everything that we can do to make that happen as fast as possible. But yeah, just spending more time with our patients and treating them as a whole person, not just kind of poking them where it hurts, but seeing if there's anything else in their lifestyle that we can improve to make them better.
Yeah, you look at it from a holistic lens where we are holistic practitioners by, association, but holistic means looking at the whole person, where most people come to us because they're in pain. I've had a few that heard through the grapevine, hey, you can help me with shoulder function or whatever it may be, but usually they have that problem. So it's kind of like you have to start there. You have to address what brings them in. We spend that extra time opposed to a traditional chiropractor where it's maybe 5-10 minutes if you're lucky, crack, roll over, crack, see you later this week for 8 more weeks kind of situation. But if you really get to know someone as a patient, but as a person, and see what they're striving for just in their day-to-day, you can really form a treatment not just around their pain, but also their performance and what they're trying to do with their life, right? Because you're not trying to get that same... I don't know if you're anything like me. I hate when a patient has the same injury. It's either I did something wrong or I didn't educate them enough. You have those patients that aren't going to listen. Yeah. They kind of have to learn the hard way. Yeah. But hopefully after the hard way, you can kind of convert them more into that performance care. So obviously, chiro, people think adjustments. You kind of already mentioned we don't do that. But maybe Maddi, I'll start with you because the way you two practice, you have similarities, but there's definitely a divergence there. So what does a normal kind of treatment look like for you, and what are you really looking at?
Yeah. So I think I only have a few male patients, which is the big difference for sure. I work a lot with women's health, so pregnancy, postpartum, and then pediatric population. So I see a lot of women that haven't been treated very well. So that's, like I said, I take the time to see what's actually going on with them, if I need to help them nutrition-wise as well. But that first appointment, I ask all those hard questions, like stress level, sleep, if they're a mom that has a lot going on, how we can try and bring down their nervous system a little bit so they can be out of pain a little bit quicker that way too. And then a lot of pelvic floor questions, because I swear I'm running a pelvic floor TMJ dysfunction and bunion clinic right now.
Oh, nice.
A lot of my
3 heavy
patients
hitters.
have those things. And so it's, top to bottom. But I'm making sure I'm asking them, can you jump on a trampoline without peeing your pants? Can you sneeze without peeing your pants? Do you have hemorrhoids? Random stuff like that I'm sure they have never been asked or they're too embarrassed to ask. So diving deep into that, and then making sure that we're doing any soft tissue treatment, any exercises, any adjustments within that first appointment. But just auditing stuff and rechecking them every time that they come in to make sure I'm actually changing the tissue and not just the pain, because that can come back.
Yeah, absolutely. That's where we kind of mentioned it earlier. People usually come to us because they're in pain, but usually pain doesn't just start out of nowhere unless you had a trauma or a fall or something like that. Even if you quote unquote threw your back out, it was usually a ticking time bomb. So that's where treatments are important, whether you're doing muscle release. Obviously we adjust our patients, but it's only kind of a couple tools in the tool belt. How important, I know we'll get into this with you, but I'm curious just from more of the women's health perspective, how important is finding the right exercise strategies, and are you sending those people home with those exercise strategies? Kind of what does an average patient go through with you?
Yeah, I think I kind of preface it with I love homework for people. Don't be scared of that. I'm going to make it easy for you to sprinkle it in throughout your day. But everyone gets homework, because I don't want to be the reason why they feel better only in my office and they're not doing anything for themselves, they're not going to get better if they don't do anything at home. So
So true.
everyone, majority of people get McKenzie something, like depending on what they need. But then we're progressing into different loading strategies in that good position for their body. So if it's DNS or some other kind of core pelvic floor exercise, they definitely get that. But we always have good understanding of what is a realistic time of day where you have 5 minutes to do something. Is that possible? Can you do it every other day? Just trying to give them a goal. And that a lot of times helps them have a little bit of me time where they usually don't have that if they're a mom especially. But yeah, everyone gets homework for sure. Everyone.
Yeah. Well, if any of my patients are listening, they're familiar with that. But homework or home exercise programs are super vital. I mean, I tee it up to my patients where if I'm only seeing you 15, 20 minutes a week, you're spending way more time away from me. If you want me to do more of the heavy lifting, then I got to see you multiple times a week. If you could just find 5 minutes in a given day, do these simple strategies, then we can work together to get you those results still efficiently. So kind of, you've mentioned it, but really educating them and making sure they know why they're doing a specific thing. It relates to what they're coming in with or what they keep getting over and over again as far as symptoms. And most people don't want to spend more time and money, so if you tee it up right, they'll buy in a quick way.
Yeah.
Absolutely.
So let's pivot over to the other side of the table, per se. What is normal? I'm guessing you and I are probably pretty glove in hand as far as the way we practice.
Yeah.
Obviously, we've known each other for a little bit now.
Yep.
But what does a treatment look like with you, and who do you normally see as kind of your patient or your clientele? The rest of this interview's file was corrupted. Solo episode with Billy coming soon.